Let's begin by taking a look at some of the muscles and trigger points involved with neck and upper back pain. First, in red, we have the trapezius trigger points. On the left, we have the lower trapezius trigger point, which refers pain to the shoulder, the nape of the neck, and the base of the skull. On the right, on the bottom, we have the middle trapezius trigger point, which refers pain locally on the inside border of the scapula. And next, we have the upper trapezius trigger point, which refers pain at the nape of the neck and strongly to the base of the skull. Next, in turquoise, we have the levator scapula trigger points, which refer pain strongly to the nape of the neck and also create restricted range of motion in the neck. Next, in purple, we have the scalene trigger points, which refer pain to the medial border of the scapula and just above, again to the nape of the neck, to the shoulder, and down the back side of the arm. Next, in green, we have the rhomboid trigger points. These refer pain locally to the medial border of the scapula, which your clients will describe as a deep aching pain between the shoulder blades. And here in orange, we have the posterior cervical trigger points, which refer local pain to the posterior neck. Clinical findings for the trapezius trigger points. It is extremely rare that I see a client with no active trigger points in the trapezius muscle, no matter what their chief complaint might be at the time of their first visit. Having said this, let's take a look at the associated symptoms for trapezius trigger points. Clients will present with pain on the back and side of the neck, top of the shoulder, between the shoulder blades, back of the head, pain behind the ear, at the angle of the jaw, and in the temple regions. Occasionally, clients may present with a quiver-like sensation in their upper arm. Activating or perpetuating factors for trapezius trigger points include automobile accidents, any activity that requires the muscle to carry the weight of the arm for an extended period of time, forward head, rounded shoulder posture, postural asymmetry due to scoliosis or due to lower limb length inequality, a heavy backpack or a heavy shoulder bag, emotional distress or anxiety, long telephone conversations, sleeping on their stomach with their head turned to one side, playing the violin, arm rests that are too high, holding the arm up and forward for a long period of time, and prolonged bending and reaching forward while sitting. Here are some associated symptoms for the levator scapula muscle. Dr. Travell refers to this muscle as the crick in the neck or the stiff neck muscle. Clients will typically complain of pain at the angle of the neck, just at the base of the neck and the shoulder area. They are unable to turn their head to the same side because of the contraction. If they're turning their head to the right and it hurts there, then they definitely have a problem in the right levator scapula. They may also complain of shortness of breath. Some factors that may activate or perpetuate levator scapulae trigger points include working at a computer with the head turned, holding a telephone with the shoulder, carrying a heavy bag with the strap over the shoulder, chilling of the muscle during sleep, sleeping on their stomach with their head turned and elevated on a pillow, emotional stress that they may describe as the weight of the world on their shoulders, the use of improperly fitted crutches or a cane, swimming, a car accident, and the acute stage of upper respiratory infection may also activate levator scapulae trigger points. Symptoms associated with trigger points in the scalene muscles include persistent aching chest pain in a two-finger-like pattern, pain between the shoulder blades that concentrates in the area just medial to the superior angle of the scapula, superficial anterior shoulder pain, pain on the anterior and posterior part of the upper arm that often disturbs their sleep, pain on the radial side of the forearm that skips the elbow and travels down the thumb into the index finger, numbness and tingling in the arm, hand, and the thumb, edema or puffiness in the hand, especially in the morning. Clients with active trigger points in the scalenes typically do not have restriction in the neck motion, as they would with active trigger points in the levator scapula muscle. Some factors that may activate or perpetuate trigger points in the scalene muscles include automobile accidents, strong pulling movements such as playing tug-of-war, swimming, carrying heavy objects, coughing, scoliosis or lower limb length inequality, and limping because it causes a distortion in the client's posture. Associated symptoms for trigger points in the rhomboid muscles include superficial pain between the shoulders, especially at rest. The pain is not influenced by any ordinary movement. And clients will complain of a snapping or crunching noise during movement of the shoulder. Some factors that may activate and perpetuate rhomboid trigger points include prolonged holding of the arms above the head, such as when they're painting a ceiling, and rounded shoulder posture while working at a computer, sewing, or reading. Associated symptoms for trigger points in the posterior cervical muscle group. Clients may complain of pain in the back of the neck or tenderness, pain at the angle of the neck, pain between the shoulder blades, pain at the back of the head, tenderness, numbness, tingling, and burning at the back of the head, painful restriction of neck movement, especially during flexion, and pain in the temple region of the head. Some factors that may activate or perpetuate trigger points in the posterior cervical muscle group include automobile accidents, forward head posture, and poor pillow placement during sleeping.